Welcome everybody to our second Emerging Technologies webinar with the doctors Jess and Robert Trimble. It's always fun to say that all together. Thank you for coming. Today you all have a new topic for us. I'm going to let you all explain, and once you share your screen and such. And thank you everybody coming to listen. So Jess, Robert, take it away.
Thank you for having us, as always. I'm glad that you find the Doctors Trimble entertaining. We really enjoy doing these for you guys. So let me share screen, see if we can get this right. Share and present. Oh, I don't know if that worked.
Come back. Almost. Yeah, I think you're full screen.
Mm-hmm. Okay. You can see my point of care devices here?
Yep.
Okay, so we're talking about these today, I think primarily because, as we all know, the way that technologies are sort of exponentially improving, these point of care devices fall into that very same exponential curve. We're seeing some really incredible growth of some of these devices due to two different things. One, increased research and money flowing into the actual science side of these things, but also the machine learning and neural network and artificial intelligence side of things. And those two sides are playing together really nicely to create much lower cost and easier to use point of care devices globally. So we're going to touch on all of that. Similar to our last session, we're going to do some high-level definitions and why and market data, and then we're going to go into a lower level of what are some of the current point-of-care devices, how are they being used in clinics, and then we're going to talk a little bit about the experience that these brings and how it changes the way our clientele are working with us and viewing us as hospitals and practitioners. So Robert, I will let you kick off the high level here.
Yeah, thanks, Jess. Yeah, looking forward to talking with you guys today. This is going to be a lot of fun. It's something that we've been looking at quite a bit lately, and really excited to provide you sort of a high-level look here. Jess will dive into sort of how it's showing up on the front lines, and we're going to highlight some how it's also, these things are enabling unique business models and practice models to be created through their use. So a little bit on the high-level stuff here. Let's go to our definitions. Next slide. So point of care devices, point of care diagnostic devices. These are any device that's used to obtain diagnostic results while the patient or close, while with the patient or close to the patient. They can be used in doctor's offices, hospitals, in the patient's home, and point of care diagnostic devices give very quick feedback on all sorts of different medical tests. And while these used to just be standalone tests, like SNAP tests or witness tests, like many of you are probably familiar with, or things like blood glucometers, which is just a standalone test. These are now evolving into tests that are backed up by a much more robust back end, like Jess was mentioning earlier, that's supported by machine learning or neural networks, so that the test is done and a diagnosis can be made instantly, and that especially as more tests are run and that data set increases, those diagnostic results are increasingly more reliable. Okay, let's go to the next slide. So these tests, they can they can kind of span a very wide variety of different types of tests. And some of them we're already comfortable with, and they've been in the industry for years. Several of these are standard in many practices. And like we mentioned earlier, showing up as those IDEXX SNAP tests for like heartworm or retroviral diseases like in cats, like FELV or FIV. But then you also have those benchtop blood analyzers or urine analyzers. We're all familiar with those, but what else is there? We're going to go through some of those point of care devices and the diagnostics that are kind of making waves in the space today. But again, I think we want to make sure we save space for a discussion around how these devices change the way a practice functions. Whether they're creating unique experiences that add value to the client that then enable new business models to make sense, or whether those devices are opening up brand new markets to serve potentially underserved populations. So why are point of care diagnostics important? We listed off a few of the ideas here. I'm sure several of you can come up with other ones as well, but essentially they allow rapid triage and treatment decisions to be made more quickly, and not just within the centralized hospital setting from a variety of locations. They can be used in telehealth and connected care, which is a rapidly we'll say it's increasing in popularity and becoming more and more relevant, especially as practices struggle with getting clients in the door to things like COVID and how to manage that workflow appropriately. These point of care devices, they enable an earlier detection of disease because you're not waiting around for those results to come back. And as a result, because you can take action right away, you tend to have improved pet compliance with your client as well. Ultimately creating a better experience for the client, better health outcomes for the pet. And then it's also more cheapable. It's also cheaper and more portable of a testing method, which can, again, like I mentioned earlier, help you tap into some underserved markets or underserved areas. Okay, so real quick, I want to give you a little bit on some market data, the general overview of the size of the overall diagnostics market. I want to give you the size of the point of care market within veterinary medicine, as well as some forecasts for the future growth of this space. Okay, so there's probably to no one's surprise, the global point of care diagnostics market is growing. The overall point of care diagnostics market is projected to reach $46.7 billion US dollars by 2024. And that's up from $28.5 billion in 2019 last year. And that's growing at a compound annual growth rate of 10.4%. So definitely growing. There are some factors that are driving the growth of this market, including things like the high prevalence of infectious disease in developing countries. There's also a growing general trend for government support for these devices, as well as a rising preference for home health care across the globe. There are a few things that could restrict the growth of this overall market, including things like product recalls. There could be a lack of alignment between the results that are given by those point of care devices and what's being actually seen in an actual laboratory setting, and that can cause some distrust in those devices and lack of use and resistance to their use. What else? We can also see regulation slowing that down, time-consuming approval policies that could also restrain the growth of this market. And then I think one of the things that came up recently at the AVMA Economic Summit is just the general resistance to change. And that's true in vet med as it is in human healthcare, and a general reluctance from within the healthcare fields to really adapt their existing diagnostic practices could be another thing that slows down the growth of this market, or at least restrain its growth a little bit. So from a regional standpoint, North America, it did take the largest share of the point of care diagnostics market back in 2019, and that's generally owed to the growing prevalence of lifestyle diseases, increasing number of product approvals, as well as government initiatives within North America. And when we think about the end user of the point of care diagnostics market, we think about groups like clinical laboratories, maybe ambulatory care settings, hospital or critical care settings, home house call or home care settings, other uses for sure. But the fastest growing end user segment of the overall point of care diagnostics market was in this home care settings segment. And the high growth of this specific segment, they attribute it to the increasing demand for home health care, and therefore the subsequent increase in demand for the rapid tests that can be done in that setting, in the home. So that's from a end user standpoint. Let's look at from a product standpoint now. The products that dominated the point of care diagnostics market in 2019 were glucose monitoring products. And this is compared to some of the other products in the space, such as things like infectious disease testing, pregnancy testing, fecal and urine testing, drugs of abuse testing, things like cancer or tumor markers testing for those things, and a lot of other ones. But the glucose monitoring devices took the largest share in 2019, at least regarding the overall point of care market. So that's the overall. Let's narrow in a little bit further and let's get into the veterinary diagnostics market. It is also growing. The size is projected to reach $2.4 billion US dollars by 2025. And that's up from $1.4 billion last year in 2019. And that's growing at a little bit slower than the overall market. It's growing at a compound annual growth rate of 8.9%. And there's a lot of different factors that could be driving the growth of this market over that period of time, including anything from the increase in prevalence of zoonotic diseases among companion animals and livestock animals. We could also see the subsequent growing need for the rapid detection of those diseases. And then not to mention some of the basic advantages of using these point of care devices and testing over laboratory analysis, which can take a lot longer. If there is anything that could restrain the growth on this market within the veterinary space, it could be due to partially, or at least partially due to the high cost of some of these veterinary imaging instruments. We do have a slide a little bit later that highlights how the cost is similarly to other exponentially growing information-based technologies. The cost tends to decrease exponentially as well. We've got a slide later with an example showing that. And then just from a regional standpoint, let's go through that same sort of look, a granular look within the veterinary market here from a regional standpoint, an end user standpoint, and a product standpoint. So from a regional standpoint, again, North America continues to take the largest share of the veterinary point of care market. A variety of factors can be attributed to this growth, whether it be the increasing adoption of companion animals, to growing veterinary healthcare expenditures by consumers, as well as the rising demand for animal-derived food products. So that's from a regional standpoint. North America is still taking the cake. From an end user standpoint, veterinary clinics, the veterinary clinic segment accounted for the largest share of the veterinary point of care diagnostics market in 2018. And this is again compared to other segments within that space, such as academic institutions, veterinary hospitals versus veterinary clinics, and home care settings as well. And in 2018, the veterinary clinics segment, they did account for the largest share of the veterinary point of care diagnostics market, attributed to the growing number of patients that are actually visiting vet clinics and increasing the number of private clinical practices. Okay, so that's the first two, regional standpoint and an end user standpoint. Let's look at the product standpoint again for the veterinary point of care market. So within the veterinary POC market, it's segmented into consumables and instruments. And per the data that we found here, consumables, they accounted for the largest market share in 2018. And again, attributed to things like the increase in demand for these rapid detection of diseases, increasing prevalence of those diseases, and the general growth in the companion and animal population on a global scale. So that's a real quick overview of the point of care market as a whole, as well as a little bit narrower focus on the point of care market within the veterinary space. And we linked a couple of those articles there, or research, if you want to go and look that up a little bit more. We're going to turn it over to Jess now. She's going to give you some even more sort of granular focus on how these devices are showing up in the real world. And then at the end, we're going to come back to sort of how these point of care devices are enabling unique experiences for the customer that create novel points of value, which ultimately can open up the opportunity or for the potential for previously untenable business models to make sense. So I'll go ahead and turn that over to you, Jess.
All right. So I think based on everything that Robert just said, with showing the growth that this market has to have, or that will be coming, and knowing too how technologies improve in decreasing cost and increasing ability to compute more, have more information, have more data. I would view all of these products that we're going to be talking about almost as minimum viable products. These are the products that have been created based on what we have today, but we know 5 years from now, the computing power of these will be exponentially increased. They will be significantly cheaper. And so I think we're going to see some really big changes in these products. And so the ones I'm showing you today, they're cool. Give it 5 years, they're going to be even better, simply because they will be cheaper, faster, have more information and data available. So I'm going to go through some various categories. The companies that I'm listing, they're just companies that are out there. I have no links to any of them. I don't support any of them. So go with that in your brain. So the first one, these guys, and I'm not entirely sure how to pronounce this, Eucori maybe, but regardless of how we pronounce it, what they've done is they've taken a stethoscope and essentially attached it to a device that will amplify chest sounds by about 20, as well as record them. So important for two, they actually have a stethoscope specifically for hard of hearing veterinarians, which warms my heart a little bit. But otherwise, they are focusing on finding ways that we can use these to teach students, because we can record these heart sounds, but also what do we do when we put one of these in the hands of a client? So what comes to mind for me is an old cat with hyperthyroidism. Eventually, they all get something called hypertrophic cardiomyopathy. Eventually, they all get a heart murmur. But if we catch it early, we can prevent that heart damage. And so if I can have my clients purchase one of these and I teach them where to hold this and say, once a week, I want you to record some heart sounds for me and send them to me, and we'll monitor them, we will be able to catch those heart issues so much earlier than if we just waited for this cat's yearly or bi-yearly recheck. So things like this are going to allow our clients to be able to do in-home checks of their own patients if we can just take the time to teach them the proper way to do it. This ties in beautifully with telehealth. All of these tie in beautifully with telehealth. Also, you know that I'm the person that ties everything in with telehealth. But something like this really can help us to catch those issues earlier, monitor problems for chronic diseases as they're going along, monitor treatment regimens, the whole 9 yards. Let's see. We talked about smart collars a little bit with our last event, but don't discount these as just, you know, some passing fad for pet owners to throw on. These can be used as a point of care diagnostic. We can diagnose things like, you know, elevated heart rates or respiratory rates, or, you know, we're not going to get a disease necessarily out of these, but we can diagnose that there's a problem going on that needs further workup. And so again, not a specific diagnosis, but a definite diagnostic tool that is about as point of care as it gets. You know, it's attached to the animal at all times, and this data can be remotely given to the pet owner or to the veterinarian to interpret. So I imagine that we're going to be seeing more and more of these popping up here very soon as well. Fecal testing, this one I really love the idea behind. So fecal testing, obviously, it's been around for decades. It's nothing new. What is new is how we're getting it into the hands of consumers as a point of care test. So traditionally, you adopt a kitten, you bring the kitten home, you decide after a couple of weeks, oh yeah, I need to get it caught up on its shots, or maybe it has diarrhea, or maybe you're, you know, one of those people that can't afford to take your new kitten to the vet or whatever. Things like this, you can actually pick up at Target, and there's no actual veterinarian associated with this. You can just go to Target, pick it up off the shelf, send it in. They have actual real licensed veterinarians on their team, people who are reading these. I believe they're also doing some cool work with some AI recognition of some of these parasites. But then the test comes back to you as a pet owner saying, hey, we don't see anything, nothing's wrong, or hey, we noticed X, Y, and Z, go talk to your vet and get treatment. And so this for me is a major market expander. We're going to be able to find those people that, you know, maybe wouldn't normally go to the vet for something like a fecal test, but this at least will get them in the door for treatment and then other lifelong care down the road. So we're going to be seeing more and more of these simple diagnostic tests that are available directly to a consumer in these, you know, big department stores. And I think this is just the very beginning of that. So I'd expect to see even things like urine testing coming up here very soon. So these guys, Cluj, they're doing a really good job with it. You know, there's definitely some companies out there that are maybe a little more questionable, but these guys seem to be really doing it right. So I'm interested to see where that turns up. Petnostics and RapidBack, if we want to talk about urine testing as a point of care, Petnostics, they've been around for a while and it's nothing remarkable. It's a urine test strip. You can get those at Walmart, super cheap. But what they did is they just changed up how it works. They put it in a circular pattern on top of a cup so that you can catch the urine, put the little circular cap back on, invert it, and there's your test strip running. And then with an app, it will actually look at the colors and tell you, hey, you know what? Your cat's urine specific gravity is quite low. That could be a problem. You should go to the veterinarian. And so while this is not, again, diagnosing, hey, you have this disease, it is saying, hey, there is something wrong. You should go to your vet. So again, this is something that you can buy off of Amazon very simply. And for pet owners that have animals with chronic diseases, or for those pet owners who maybe wouldn't necessarily go to the veterinarian as quickly, these things will, again, sort of open up that market and give pet owners a little bit more freedom and accountability, I guess, in testing their own pets. Now, RapidBack, they've also been around for a few years. And basically all it is saying, it's a binary answer, yes or no, if there is an infection present. And I believe specifically with E. coli, which is your most prevalent bacteria causing urinary tract infections. But for a cat who, say, has hyperthyroidism, we'll keep using this, if they're urinating more frequently, some people might think, oh, my cat has a urinary tract infection, I need antibiotics. When in reality, it's just their thyroid not working correctly. And what they can do then is we could just quick run this test and say, yes, no, yes, bacteria is present. Okay, yes, this is a UTI. We need to actually do antibiotics. Or no, it's not. Hey, let's not misuse these antibiotics and use them on something that's not an infection. And so both of these can be done in home, very easily can be left behind for a pet owner and taught how to use so that they can do their own monitoring in their own home on their own time. So when we think of point of care, we need to think not just point of care diagnostics for me as a veterinarian, but also a point of care diagnostic for the pet owner, because they do some of their own diagnosing of sorts of knowing whether or not their pet actually needs medical care. If we move on to the next one, blood testing. So as Robert said earlier, benchtop analyzers, they've been around for years. This is nothing new, but this is considered a point of care diagnostic, right? If I send lab work off, it's going to take usually 24 hours at minimum, sometimes a couple of weeks to get a test back. These benchtop analyzers significantly decrease that time. A lot of these companies also make these awesome little lateral flow assays, which are a huge part of point of care diagnostics for a variety of things. Heartworm, retroviral testing, progesterone testing, there's a ton of them, and more are popping up as there is more and more research being put into finding different analytes that appear with only very certain diseases. And as we learn the specifics of diseases more and more granularly, we are able to test for these very specific things through these assays. And so we'll find more and more of these popping up in the near future. There's a few really cool ones that I know of that are sort of right on the verge of coming into the market. So I don't want to discount some of these bigger companies and the work that they're doing in point of care. This is not all just little startups. This is the big players playing in this too, because this really is not just veterinary. This is human health as a whole, and as zoonotic diseases, infectious diseases. This is important on a global scale, and so they're going to be very involved in this. A little bit more on blood testing, more on the more specific side. If you haven't heard about the Freestyle Libres being used in dogs, they're awesome. This is a human thing that's been translated into dogs. They've tried to use it on cats, but as usual, cats are difficult for everything. And so it's worked not with quite as well or quite as spectacularly good results as with the dog. And then we have the one below it that you see that's actually a point of care analyzer for anemias. If we wanted to test anemia for a pet, I would have to take that blood sample, put it in a centrifuge, and then either run it through an analyzer or look at a microhematocrit chart. This takes a single drop of blood. Can do it in the home, no problem.
Hey, Jess.
Yeah.
On the Freestyle Libre, I was speaking to somebody, I think it was Caitlin DeWild, that some of the doctors in her practice were using it.
Mm-hmm.
Are you gluing that on with, or are you stitching it also? Because she said they did a little stitch to make sure it's stuck.
Yeah. I've heard both ways. Certainly it's got to be stuck on there pretty well for it to work. So it has like a very, very tiny catheter that I believe goes subcutaneously and reads interstitial fluid. So if that gets bumped around, it's not going to read right. So surgical glue, you've got to shave. It does take some prep for this to work, but usually can be done with, you know, a little sedation or just a little local. I don't think you really need to do a whole lot to get these things stuck on there. So I'm going to go through just kind of a quick flow. I'm not going to do this for all the products, but I thought this was an interesting one using this Freestyle Libre, because this was a human device that we're translating to veterinary medicine. And it makes a huge change in the lifestyle of the pet and the pet owner. Oops, going backwards. Why is that happening? What happened? Hold on. So with these Libres, if we think about canine diabetes, for instance, what did we have to do when diagnosing a dog with diabetes, right? We were waiting for the pet owner to recognize that there was even an issue. And so, you know, a couple of weeks of I'm drinking too much, I'm losing weight, I'm urinating everywhere. Some pet owners notice that right away. Others, you know, it takes a couple of weeks when you're with your dog every day to notice that they are losing that weight. And so we see a few weeks pass. Dog comes in, we do the blood work, we see a high blood glucose. We say, okay, here's some insulin, but really we need to do a full blood glucose curve, probably in a few weeks from now, once that dog is stabilized on that insulin dose a little bit, to see how this dose is affecting it, if it's the right dose of insulin. So the dog comes back in 2 weeks to a month. We do the blood work again, say, hey, you know what, this needs to be adjusted. Dog comes back in another month, we do the blood work again, which is typically a blood draw every hour over about an 8-hour period. But you know what, if that dog's stressed out, its blood glucose might not be accurate. So we could be bringing these animals into an environment which is actually ruining our data to begin with. This is especially true with cats, right? Stress glucose in cats messes up everything. So sometimes what's even the point of doing it if we know it's going to be incorrect data to begin with? So we're just going to sort of rinse and repeat this. Come in, have a glucose curve. Is it accurate? Is it not? Let's, you know, change the insulin dose, see what happens. Over this time, we run a much higher risk of developing diabetic neuropathies and diabetic cataracts because we're allowing the pet to go longer with a potentially unregulated glucose. So let's change this to, there we go. Change this to using something like the Libre. So dog has these symptoms. Hey, let's throw in a little telehealth as well, because that's what I do. Your clinic has telehealth and they reach out and say, hey, I think my dog's, you know, peeing more than normal for the last couple of days. What should I do? Rather than waiting and scheduling an appointment, they now have access to talk to somebody and see if this is a problem. Your tech should recommend, hey, this really needs a workup. Great. Same thing happens. Dog comes in, blood work done, diabetes, diagnosed, insulin prescribed, but hey, let's apply a Freestyle Libre at the same time. So now, instead of the dog coming back in a month and then seeing if that's right in a potentially stressful environment where we don't really know if that glucose is right, this dog is now getting its blood sugar read approximately every 5 to 10 minutes around the clock for 2 weeks, approximately, or until it falls off or they kick it off, but they should last about 2 weeks. That is the most accurate blood glucose curve you're ever going to have, because you're seeing the dog's actual exercise and actual food and actual environment influencing this. And so we're going to have a much better patient outcome. We're going to reach the proper insulin dose much faster. Having that telehealth, obviously, for the pet parent to reach out is going to be, in my opinion, critical to any good patient outcome. But basically, you can see how much faster and how much better it is for the patient to be able to utilize something like this rather than coming into the clinic time after time. Other blood testing, I thought this one was cool. I've got to throw in something large animal for this as well. Stable lab. So there is an analyte in a horse's blood that only pops up with infections. I can't tell you what it is because I am no equine vet, but in my reading of this, they found this one specific analyte. I believe they called it SAA, but basically it only pops up if there is truly an infection present. So let's consider a horse with respiratory signs. It's coughing. This could be hepatitis, this could be asthma, this could be pneumonia, this could be a tumor. Chest x-rays for horses are not the best or easiest thing to do, but using this, you can at least rule out pneumonia in a barn setting, right? And so we're able to, you know, if this horse has an inflamed joint, is this something like a actual like bony spur causing inflammation, or is this a joint infection? Just differentiate that and get a diagnosis. When you're in a large animal setting, that's really important. Body temperature. So this one is a little bit more, I don't know, maybe off the beaten path because, you know, thermometers have always been a point of care device. We've always got one in our closet. However, this one is made more so that a pet owner can do this at home. It will read an ear temperature or an axillary temperature. And so for pet owners that need to monitor their pet's temp and can't do anything, you know, taking a rectal temp at home is not the best thing to do. This can open up an ability for diagnostics to be done in home by the pet parent again. And then ultrasound. If we didn't talk about imaging, we would be failing here. So imaging is absolutely a point of care device. And this one is ultra cool in my opinion. So ultrasounds used to run off of these piezo crystals, and a lot of them still do. I remember in veterinary school sitting in the basement of our radiology unit with that ultrasound probe in my hand and being threatened within an inch of my life by the radiologist saying that if I broke that, it was a $30,000 probe. That's a big deal. You know, an ultrasound machine would cost a good one $100,000 with all of those quartz crystals and the probes. Now we have one that can actually use all the same types of probes, so same transducers plugged into your iPhone for about $2,000. And so the fact that we can now do really high quality ultrasound patient side in a barn, in somebody's home, in an ER for a price that is really incredibly good compared to even 10 years ago what an ultrasound used to cost. I think this is the perfect example of what happens when that technology goes from our old school to a silicone chip. Because once it's on a silicone chip, it gets cheaper and better exponentially quicker. And that's what we're seeing with the butterfly. There will be others coming out, other imaging modalities that are starting to switch over to this. So again, you know, I mentioned at the beginning, we're talking about sort of the minimum viable products that I think all of these are. This is just the beginning of where these are. Give it 5 years, they're going to be spectacular. And then last for me, if we didn't talk a little bit about machine learning, I think we would be failing as well, because machine learning in combination with these point of care devices, I think is where things are going to get really interesting. And this is a few years down the road, I think, for us to really combine these successfully. But there was this is one study that I found really interesting. So in Ghana, there are 1.7 microscopes per 100,000 people, but there are only 0.85 people per 100,000 that actually know how to use a microscope well enough to diagnose the things that need to be diagnosed. And so consider this, less than 1 person per 100,000 who can look through a microscope and diagnose an intestinal parasite in a child in Ghana. This is a problem. So what they did is they actually 3D printed this handy dandy little stand that clips onto a microscope. You can stick an iPhone on there. The iPhone has this machine learning algorithm built into it, and they taught it malaria, tuberculosis, and intestinal parasite detection. They determined that it was as accurate as the high level experts in the field. And so these are the experts. So this works really well. And they were actually able to, you can throw a microscope in a backpack and trek out to the places that need it the most. These lower income areas that are often higher disease burdens as well and need this the most. And so they discovered that as long as they could train somebody to focus a microscope to 1,000x, that's all they needed. They didn't need to know how to find a plasmodium inside of a red blood cell to diagnose anything, right? All they had to do was just flip that iPhone on there, get it focused, and hey, we can now diagnose malaria in these most remote villages and help the people that need it most. And so on the human side, obviously, this is a major, major win. This is cheap. You can get a microscope on Amazon for 90 bucks, right? iPhone piece of plastic from a 3D printer. This is a really inexpensive way to diagnose diseases. And if we can sort of extrapolate this out now to our own veterinary deserts that need this care of intestinal parasites, tick-borne diseases, things that can be easily read just by a blood smear, new technologies like this will allow us to help people that can't access veterinary care in this country otherwise. And I think large animal, this will really be great. You know, there's a lot of flocks of sheep and herds of cattle in places that they just can't get a veterinarian to come that have anaplasma, right? That's a really simple diagnosis and actually not that hard to treat. But if you can't get a vet out to look at a blood smear, there's nothing you can do. This type of technology will really, really help us in situations like that. I'm going to bump it back over to Robert now from here.
Yeah, thanks, Jess. Boy, the ultrasound one sticks out to me in my mind as just another big technology that opens up potential business models that were previously not viable. And I'm going to get to a couple of those here in just a moment. But on this cytology slide here, it almost seems quaint to bring up the story of Kodak and how they completely missed the innovation of digital photography, right, until it was too late. And in the shift from analog to digital, photography hopped on that exponential growth curve that we've been talking about, right? And it hasn't slowed down since. And this is now being applied to cytology. So digital imaging and cytology, it is exploding on the veterinary scene. And Lacuna Diagnostics and Scopio are some of the companies who are at the forefront. To put this into perspective, for a veterinary hospital, having this technology in a vet clinic is kind of like having an in-house clinical pathologist with the ability to provide answers in minutes rather than in days, and often while the client and the patient are right there at the hospital. Lacuna was formed back in 2016 when no one was really doing digital microscopy. They're leading at the point of care space, having done around 25,000 live cases since they were formed. And Scopio, they're also in the digital imaging space. They're similarly on a mission to provide high quality and fast diagnostic tools for veterinarians. They're betting on high resolution digital cytology, as well as artificial intelligence in order to streamline routine diagnostics and increase the diagnostic accuracy. And so Scopio, they're aiming to help vets perform more powerful analysis of things like hematology and cytology samples. So again, the idea here for these companies is to be able to digitize the slide, have an AI model locate, pre-classify, and stratify the components of a blood smear. Scopio, I know I just spoke with their owner, one of their founders recently. They did just receive FDA approval for the human product, and these products will soon make their way onto the veterinary market soon after. One of the co-founders of Lacuna actually was a student that went through the Veterinary Entrepreneurship Academy as well. So that's how we kind of know these two companies and can speak to some of what they're doing. So maybe to finish off here, we've been talking at a very high level about the market and where things are going at the overall broad point of care market, where things are going with the broad veterinary point of care market, how these specific point of care devices are showing up across a range of different domains, whether it's body temperature, blood testing, ultrasound, digital microscopy. Mentioned Lacuna here. They're a great example of how the decreasing cost of new technologies enable new business models. So back in 2016, the point of care technology cost a practice around $70,000 to $80,000. And the only practices that could really afford this technology, the scanning technology that they had produced, they were doing around 25 to 35 samples a month in order to pay for the equipment. Now today, though, due to the exponentially improving price to performance ratio of these emerging technologies, the scanner is around $15,000 to $20,000. So pretty significant drop in cost. And this means that even hospitals who only, for example, do 10 cases a month, instead of the 25 to 35. Now, if they're only even just doing 10 cases a month, they can afford this technology. And so also improvements in cloud storage and data transfer rates also were a couple of factors that made this business model possible. But the point here is this, that the increasing performance and decreasing cost of these information-based technologies that we've been talking about and how they're emerging, they can create the environment for novel, previously untenable business models to all of a sudden make sense. And I think regardless of the technology, it comes down to using the emerging tech as a tool that adds value to the patient, adds value to the client, and adds value to the veterinary team. Fuzzy, from our most recent experience, is another example of how a point of care device has enabled a business model to make sense. So whenever this company was delivering house call appointments, we were using heartworm tests in order to help drive enrollment rates of this subscription-based business. So when this company was doing house calls, it first offered clients a free first visit to try us out, to try out the company before they ever even signed up for it. And at that visit, the healthcare providers would include a free heartworm test. We would draw a drop of blood from the dog, and we would do the heartworm test right then and there. The results were done by the end of the appointment. The healthcare provider would give a prescription for a year's worth of preventative meds that would be set up on auto ship, making it easy for the client to take action based upon the results that we're just seeing in real time. And all the client had to do was to say yes in order to sign up as a member. And so remember, Fuzzy was built on a subscription service here to provide this house call service. So the company needed a way to help clients commit to signing up for an annual membership. And so this point of care device, this little tiny $3 or $4 heartworm test, served as a huge trigger to be able to help drive annual recurring revenue that made the loss of $3 or $4 for a heartworm test almost meaningless, because you're able to recapture so much value on the back end. But this point of care device and the experience that it created enabled this business model to make sense. And most clients, it was funny, when I would talk with them in these appointments, they would say that they'd never actually seen a test done before, let alone seen blood drawn on their pet. The pet's usually taken to the back of the office. And by doing it right there in this intimate setting with the owner and talking with them about what it means, not only do you build a stronger bond with that client, but you also drive better compliance, better customer relationships, and better business outcomes. It created a differentiated experience that was ultimately valued by the client. And in this case, it made it really easy for the client to say yes. There's this recurring theme of immediacy that these point of care devices keeps coming up and up again and again, right? This immediacy is what enables a new experience for the client that ultimately is better value for the client, which ultimately a practice can charge for. So just wanted to highlight a couple of those examples, but I mean, we could we could spend the next 15 minutes here just talking about other ways that point of care devices are enabling novel business models. But that's all that we had here for the day, folks. I think we've got a little bit of time here. We could open this up for a broader discussion, Q&A, however you want to spend the rest of this time. But it's a fascinating area of development, I think, not just within vet med, but within healthcare in general. So it's would love to strike up a conversation with you to see where you see this technology going in the future as well.
And I'll actually add to that really quick. I'm not sure that we gave the importance of the experience associated with this quite enough credit. We know that veterinarians right now have some trust issues with the public, or rather the public has trust issues with vets, right? This is something that has been happening over the last decade because veterinarians are businesses that require payment. You know, it's not like a human hospital. It is a true business. There's that automatic sense of mistrust anytime that there is those, you know, financial motivators and they don't really know, do I really need to do this test? When you can do that test next to a client and they can see that test being done, and you can say, hey, this test right here is going to tell us whether or not Fluffy has, you know, a heartworm infection, or this horse has a pneumonia. Being involved in that diagnosis automatically makes them trust it more, and makes them trust you more. And so I really think that the transparency that we'll be able to have with these devices, because we no longer have to take the dog to the back, or we no longer have to, you know, take a dog who needs an ultrasound and put them in a stuffy basement of a university's radiology department. We can just pop a probe on them right in somebody's living room. It will inspire so much more trust for our clients to have in us, to be a part of those decisions and those diagnoses. So I really think that this is going to be a major boon for veterinarians in general in regards to our relationships with our clients.
Yeah,
so we got a few minutes. Somebody other than us say something.
Well, let's pause there. What seemed to resonate with you guys in this talk so far? Did anything stick out as something that you tended to agree with, or anything you want to push back against? What stuck out for you today in this talk?
So I was going to add that, you know, my practice, I sold it now, it's almost 5 years, but I had the practice for 36 years. And I have to tell you that close to 40 years ago, I did not take the patients to the back. Everything was done in my exam room, and blood was drawn there, urine was drawn there, blood pressures were done on all my cat patients. And the buy-in from the clients was incredible. Our average transaction charge was super, super high. And yes, I had a skewed, you know, group of people coming to me because reputation of the practice was what we were offering those cat patients. But I'm going to just echo what you've said, that I think really what created the atmosphere in my practice and what let those owners feel so comfortable doing what we were recommending was because we were so transparent, you know, and when even the lab results, you know, that would be the point of care devices we had in the hospital, the fact that we could get those results right in the exam room, they would be imported into the medical record. I would have the owner stand behind me and look at my screen with me as I was interpreting lab results. It brought them into the decision making in a way that was very empowering for them. And I think it was largely what, you know, again, why revenue production for a cat practice was what it was. So it was fabulous for the cats, right? Because they got incredible health care, but it wasn't bad for us either as the practitioners, and of course me as the owner. What I'll add though, it's something you haven't discussed that I'm really excited about now, because my new passion is end of life care, is I'm just thinking about how incredible this will be for hospice and palliative care when we have these point of care devices like a tiny ultrasound that might be difficult for a practitioner to afford that's got a home-based business. But to have a $2,000 ultrasound that might just help them, let's say, know that the dog that had a hemangiosarcoma and now had a pleural effusion or an abdominal effusion, you know, quickly being able to tell the owner something like that as part of a quality of life assessment. I just think the potential is amazing. And what it's going to do in terms of, like you said, business models. You know, we already have some people that all they do is go on the road with their cold laser machine, and that could be the product that they deliver. Well, Obviously, more involved would be hospice and palliative care, but utilizing these point of care devices, I just think that it's going to be amazing.
Spot on. Well said, Diane.
Well, I'll piggyback on that too, you know, talking about having practitioners who are taking an ultrasound around like a cold laser, you know, like that's their sole business model. I think that this will also allow us to open up business models where we're utilizing technicians to do that, and a veterinarian can sit back in the office and just have these results coming into them, right? So we can train technicians to do fast scans very easily. We can train technicians to, you know, pull blood in the home by themselves and interpret these, or not have to interpret, rather just send the results right back to the vet, and have, you know, a vet on the screen in front of them providing telemedicine while the technicians in the home running these tests, getting these results. And so I think this will also open up for better utilization of our nurses and technicians as well, as they have more and more tools that they can use that don't necessarily need a doctor.
Spot on. What about you, Ron, Bruce, or Dean? Anything come up for you guys?
I just, first of all, just want to say thank you for everything that you just walked through. And I definitely learned a ton. I think one thing that I was just sort of curious about is just around buy-in from vets, and just, you know, obviously, like, you know, you both are very forward thinking, and like you kind of are more willing to adopt these kinds of technologies. But just as you talk to vets more broadly, are they willing to adopt these kinds of tools and these kinds of methods, or do you find that they'd rather have things done, you know, in their offices? Like how comfortable are they, depending on, for example, an owner administering a test themselves? Just curious, at home.
Yeah, boy, gets into a hot button issue there. I know there's a lot of vets that, you know, think some of these tools shouldn't be in the hands of clients, that they don't know what they're doing with the what was the urinalysis, petnostics, right? That those are unreliable results. I think on the whole, though, you know, just bringing it into what we've all experienced in the last year, COVID-19, I think, has accelerated the general adoption of these technologies across the whole, simply because there's been an increased need for it, right? You know, whether it be virtual care or checking people in online or whatever it is, there's an increased demand for technologies, or for companies to use technology to increase their operational efficiency during the time of COVID. So I think that's putting some pressure on just generally adopting it. But I think there's also some messaging that's coming out now, supportive messaging from the AVMA, which is, I think, also going to be helpful in encouraging not just adoption of new technology, but just adoption of recognizing that change doesn't have to be scary, that you can take one step with any of these technologies in your practice, look around, see how it feels. Does it feel okay? Is everything all right? Right? Okay, let's take another step forward, see how that goes. So I think there's a general sense that people are like tiptoeing into experimenting with some of these things. Right now, I think time is one of the biggest things that's prohibiting a lot of people from diving in at a deeper level with these, because they're just swamped with practice right now.
I'll add to that more on the side of what I'm seeing vets actually do in practice. The butterfly seems to be adopting really, really well.
Yeah.
Love it. It works great. You know, it's been at the conferences so people can actually use it and see, oh, hey, this is actually a great product. So there's been lots of chatter about that. Same with the Freestyle Libre. It seems to me that veterinarians do really well if it's something tangible. They can hold it in their hands, right? Look at this cute little lateral flow assay, right? Like, we're all a bunch of nerds and we want to be able to hold it. Things that are more on the digital side. Oh, this program is going to help me diagnose a chest tumor in this dog. Ooh, I don't know, that's kind of scary. And so when we look at the more like pure digital side, that's going to take a little bit more time. But those tangible products, I think vets are going to be much more trusting of, at least in my opinion, what I've sort of seen so far. But yeah, we're funny people, aren't we?
What about you, Bruce and Ron?
So I've been following the Cluj folks and what they're doing. Had a couple of conversations with them. I think the model's really interesting, and Dennis, I think Chimmel is his last name. I may be pronouncing it wrong, but he comes from a zoetis and diagnostic background, which I think makes his experience really strong in the space. And then there's Affordable Pet Labs, which is doing, well, so doing something similar, but what this company is doing is sending veterinary technicians into the home to collect blood, urine, or feces for diagnostics. And I just think those models are going to be fun to watch, you know, how they navigate different states' rules around who can collect and who can't, and how it all plays in. It's just going to be really interesting.
Yeah, and I think certainly how our VCPR laws change over the next few years will certainly have a big impact on this.
Yeah.
That is an entirely different 4-hour conversation that we won't touch today. But yeah, our regulatory needs over the next couple of years will really influence this market.
I think that, you know, just in closing here, because I know we're running out of time, but if you look at the number, so I go to the American Heart Society meeting every 3 years. I love the meeting. It's also in New Orleans, so that makes it really convenient and fun. But if the numbers of heartworm positive dogs are either the same or climbing, the number of protected dogs hasn't changed in 15, 20 years. So I think these type of easy access to point of care diagnostics could potentially open it up so that the underserved populations and those that need access to care, need heartworm protection, can now get an easy test and potentially go in and buy it from your Walmart pharmacy or Chewy, because we need more pets protected.
Yeah. And on that note, it's a market expander, right? We're not taking clients from veterinary practices. We are truly hitting the 20 million plus animals not getting care. And I think that, Bruce, is just like the moral of the story for me, is the expansion and all the people and pets that we can help with these that we couldn't before.
Well,
I think that's a good place to leave it.
yeah, I was going to say on that note, I think a big round of applause to Jess and Robert today. Thank you for coming and educating us and spurring some really good conversation. So thank you very much.
Oh, you're
Happy to
very
be here. Thanks for having us.
always